Hi, Dr. Yass here. This video is the first video that I'll be doing in respect to the last video I did, which was to give people the opportunity to either comment on that video or write in with questions regarding their personal issues so that I can respond directly to their particular situations so that they could get an understanding specific to what they're dealing with versus the more generalized type of videos I produce. And as I had explained, I do the generalized ones because it's impossible to speak about anything specific unless I know the specifics of the situation. So this is the first video. It's for Anna M. And she emailed me, and I'm going to discuss her case, and I'm going to describe to you and review with her the situation she finds herself, and I want to kind of go along with discussing the diagnosis she's been given, the types of treatment she's been given, and try to explain why to this point she's still having the same type of symptoms, and then go on and try to explain how the Yass method would interpret her symptoms and give her some understanding of the types of things she'd have to do to try to resolve her pain. And I think it's going to be great for her, but I also think that anyone who watches this who's in the same situation will hopefully get some insight in their particular case, because although the circumstances of how the person gets there, or possibly the types of treatments they've gotten, the results they've gotten might vary, but ultimately, in her particular case, we're talking about the gluteal region and the misdiagnosis of SI joint dysfunction. If you have symptoms in that area and you've gotten that diagnosis, this type of video is probably going to help you pretty good. So I just like to highlight certain points because it shows you about the failures of the existing model and the types of time people are remaining in pain and the types of treatments they're getting and why they're not getting the right diagnosis. So that's why I think this is very important. So to discuss it briefly, Anna has had lower back pain for 6 years that developed after she had a fall while hiking, and she fell hard on her right gluteal region. The back pain got worse after she tried to lift a cooler full of ice. Now, this is what she wrote she tried to do to resolve her pain. She tried chiropractic, physical therapy, massage, acupuncture, ozone treatment, cortisone shots, nerve ablations for facet joints, stem cells taken at the hip and injected at L4-5, S1, the SI joint, SI ligaments. She had PRP, which is plasma replacement procedure, at L4, L5, S1. She's taken supplements. She's worn a back brace. She's used TENS. She got a new mattress. And she writes, I've tried it with the exception of surgery. Everything she's done has been without surgery. So you could see this woman is passionately interested in seeing her pain resolved. And she has tried a lot of stuff, including certain things like the stem cells and the PRP. That's more, that's not standard stuff. That's kind of out there and just being suggested. In most cases, insurance don't cover it because it hasn't been tested and proven to be valid. And yet, you know, she's trying to figure out anything to get her to have this pain resolved and to return to function. She says she attached some MRIs, and I looked at the MRIs, and it's the standard type of MRI findings. She is found to have herniated and bulging discs in the lumbar spine. She's found to have foraminal impingement. So when we talk about that, what that means is that at every level of the spine, nerve roots come out, and they come out through a tunnel called a foramen. So what it's saying is that there's some sort of compression. There's a shrinking of the size of that tunnel, and so there's compression of the nerve root that's coming out. This is all the standard type of stuff. She goes on to talk about when her doctor palpates or touches, she gets pain at the top where the SI joint is. She says her hips ache. She says this is an important factor. She says, after walking or sitting, I feel locked up. Remember, she feels that after an activity, walking or sitting. My hips are tight, and the sides of my hips can have a deep ache. The sides of her hips can have a deep ache. She says that she feels like she's carrying a gun belt around her waist all day. This pain sometimes radiates down to the front of her thighs. She sometimes feels a burning sensation in the hip bones at the top of the pelvis. And again, that's kind of showing that there's a lack of understanding. So if I kind of just turn this briefly, you would see she's talking about at the top of the hip bones, but that's not really the hip joint. That's actually the pelvic rib. The hip joint's all the way down here. So you can see that when phrasing gets skewed a little bit, that can lead to people talking about the wrong types of things that might be related to the pain. She says the lower back sometimes burns, sharp stabbing pain in the left and right SI areas. Thank God she's talking about the areas, not the joints. It bounces around right to left. Originally, it started on the right side. Occasionally, I have tailbone pain. It feels like something is going to give out. After the stem cell procedures, nerve pain showed up in my buttocks and in my inner thighs. She's starting to have some foot and neck pain. And finally, let's see. This is really a sad point. The pain is every day, round the clock. She tries to use ice. She uses a wireless TENS machine. She uses a back brace. Just wrap your head around what this woman is going through on a daily basis. And she had a physical therapy evaluation and said she needs to do balance. He has me doing upper body twists, knee raises, squats, 3 sets on each on easier side, 1 set on the other side. I spend time on a recumbent bike. I have a few exercises and stretching cage. The chiro every other week does deep stretching of the hamstrings, the hips, the glutes, the piriformis. Releases the iliacus muscle, which I question because I don't know how you can get access to that. That's on the inside of the pelvis. He jams his fingers deep into the area while I'm straightening my leg. Stabilized my pelvis, having me press my knees into my hands, adjust me. The top of the table seems to unlock, but unlock me, but it only lasts a few days. He uses the Graston. It's a tool to try to massage. So then she said she had seen me on an interview, and she said that she's trying to use an exercise and was confused. And then she goes on and asks, she wants me to do a video about the SI joint. And she wants to know, do the actual lockup, do they lock up? Or is my pelvis simply shifting? Other than posture, why will my pelvis not stay aligned? The PRP stem cell crowd claims that weak ligaments are to blame. Could inflammation in the SI joint be causing some of this? What do you do? What do you do to manage inflammation? Your thoughts on facet joint arthritis? I notice most when I go from a sit to stand position, it takes me a bit to get myself straightened out. So there's a lot to take in here. The initial part of the email, you really want to wrap your head around all the stuff that the fact that it's affecting her all the time, every day. The fact that she's associated with activity. The fact that she's tried all of these types of modalities sounds like she's tried every possible thing. And my opinion is that it's all because the diagnosis that she has gotten relates to a joint, the SI joint. So if the pain was literally being elicited from the SI joint, well, who could actually fix that? What could possibly be done? Nothing could be done other than possibly some sort of surgical intervention. And she said she's unwilling to go in that path. So she stays in this cycle of trying lots of things that generally in her mind won't even work other than to try to minimize her symptom, because the only possible thing that could resolve it based on that diagnosis is surgery. Well, let's get to the point of understanding when pain would come from an SI joint. Realize that there's no indication. No one's even attempted to verify whether it was the SI joint. So a joint is responsible for creating range of motion. You have two joint surfaces, they move on one another, and that's what creates rates of motion of the joint. There is a joint space that is held by a meniscus or a labrum. So the purpose of that joint space is to create space so that the bones can glide on one another, and therefore joint range of motion can occur. If there was some sort of structural variation to the joint, which would eventually lead to some severe arthritic change, then for you to say that the joint is to elicit pain is to say that there must be a major loss of range of motion. So for the SI joint is involved in motions of the hip. And basically what it means is that if this is the SI joint right here, let me move that. If this is the SI joint right here, this is the hip joint. So for that joint to go through motion, the pelvis must move a little bit on the spine for motion here to occur. So you want to check to see if that's actually occurring here by creating motion of the hip joint. So the primary motions that are performed are knee to chest, moving your knee to the chest and going back and then separating your legs. So you would basically move the knee to the chest on the unaffected side, move the knee to the chest on the affected side where you're having pain. Then you would separate your legs. And if you saw that you roughly had the same level of limitation or non-limitation, that would immediately disqualify the idea that the SI joint is the cause of the pain, the actual joint itself. Now, is it possible that a tissue near the SI joint is creating the pain? That's a separate issue, and that's the most likely where the pain is coming from. What is that tissue? That is the piriformis muscle. The piriformis muscle runs, we'll show you again. So this is the gluteus medius muscle, but sure enough, this is your sacral spine. This is 5 fused bones running right from here diagonally to that hip joint is the piriformis muscle. And sure enough, it passes the SI joint. So it's certainly in the area, and it's certainly something that could cause pain in the area. And when she describes her symptoms as being associated with movement, that should be a red flag to people that the tissue in distress is muscle, because what tissue is responsible for movement? Muscle. Muscle's responsible. So the highest probability is that she has strained her piriformis muscle, and you could use palpation, you could use a flexibility test. The test for checking flexibility of the piriformis is to take the side that you're having the pain, you put your ankle on the opposing knee, and then you take the knee on the side that you're trying to stretch and bring it towards the opposite shoulder. So if this was the right side, I think she said it's the right side, she would take her right ankle, put it on her left knee, put her hands around her right knee, and pull it towards the left shoulder. And she would feel pain in the butt, or a tightness and maybe some pain in the butt. That would indicate the flex, and if she did it on the opposite side and there was nothing, it would show a positive sign of shortness of the flexibility and pain associated with stretch, which would reinforce the point that it is the piriformis creating the pain. Then you have to try to say, well, what would cause the piriformis to break down? And the answer is, going back to the picture, here's the gluteus medius muscle. The gluteus medius muscle is the primary muscle for balance and stability. That muscle is what allows you to stand, to walk, to move, to basically work against gravity and keep the pelvis level, which is key to all function. So if this muscle were to strain, the piriformis, which sits adjacent to it, might try to assist it and it's not in a position to do so, so it's going to compensate. So the cause of the piriformis straining is not simply the piriformis straining. It's that the gluteus medius has strained first and the piriformis is trying to compensate. So you don't treat the piriformis, you treat the gluteus medius muscle. How would you know if the gluteus medius muscle strained? Let's again look for correlative symptoms. Do you have a change in hip height or pelvic height? Is one side of the pelvis higher than the other? Is it more difficult to single leg stand and squat on one side more than the other? If someone muscle tested you, do you find that the gluteus medius is weaker on one side? These are all things that present. They will present. And they are corroborating symptoms to indicate that the cause of the pain is a strained glute med causing the piriformis to break down and elicit pain. Now, that would be fabulous if you were to be able to go to a practitioner such as the Yass method practitioner, me basically for now, who would be open to the idea that possibly the cause is muscular. But if you can't go to someone who even suspects that a muscle could be the cause of the pain, who's unwilling to see the glaring, corroborating indicators, you're never going to get the right diagnosis, which you can see that in Anna's situation, she hasn't. They're still talking about the SI joint. They're still talking about inflammation. So without being open to all possible causes, the highest probability is you're not going to get the right cause. So when we look at her questions that she's asking about, she talks about, I discussed the SI joint. Does the SI joint actually lock up? The answer is no. No, a joint can't lock up unless there's such a severe arthritic change that you do see a change in the ability of the joint to go through range of motion. If you have full range of motion, the joint is not locking up. It is a muscle that is probably going into spasm that is preventing range of motion, that's tightening to the point where you would get the sensation of locking up. So she talks about the posture she's referring to is this thing that I'm referring to. She clearly is having one hip higher than the other. And the people who are promoting the plasma replacement therapy or the stem cell replacement are saying that's a result of weak ligaments. That is pure bullshit. Absolute nonsensical crap. What you want to understand about ligaments are that ligaments are lax until the joint that it's supporting goes to its end range. The purpose of the ligament is to prevent the joint from going beyond its normal range. So if you're simply standing, unless you try to pull that knee way too high up or separate your legs way too much, the ligaments that support the SI joint are lax. It's the muscles that surround the joint that are stabilizing it in movement. So she's going to people that are in a position to never possibly understand what truly happens in function, because their business is all about convincing somebody that plasma relief, plasma replacement, and stem cells address ligaments. But ligaments are never the cause. Ligaments only come into play when a joint reaches its end range and is possibly going to go beyond it. The ligament comes in to try to prevent that. She goes on to discuss this idea of inflammation. Oh, could it be inflammation in the area? Ladies and gentlemen, let's discuss this really clear and really fast. Inflammation occurs when there's either a mechanical or systemic breakdown of a tissue. The body needs to heal it. A protein is sent to a capillary. The capillary breaks and blood goes to the area with healing cells, white blood cells in there to try to heal the area. That's what the inflammatory response is. So when blood perfuses to an area, you're going to expect it to be warm, you're going to expect it to be red, and you're going to expect there to be swelling. So the four indicators of inflammation in an area are pain, swelling, heat, and redness. I can assure you that if we look at Anna, there is no swelling, heat, or redness because an inflammatory response is not there. So anyone trying to convince her that it's inflammation and therefore she should be on anti-inflammatories or she should be taking turmeric or any of this nonsense that addresses inflammation, there's no indication of inflammation being present. So if the symptom isn't there, you can't assume that inflammation exists there. So that's another blind alley that she's been run down. She talks about facet joint arthritis. That's that crazy back nonsense. A facet in the spine is a point in the back of a vertebrae where there's a cup and then a protuberance, and when you extend your back, lean back, or even it's in the lumbar and cervical spines, if you lean back, the idea is that the facet joins together, they come in contact with each other, and that provides, instead of having independent vertebrae, the vertebrae get locked together and it kind of solidifies the spine, which is a protective mechanism because looking up is scary and arching your back is scary. So it's a way of keeping all vertebrae locked together. That's the purpose of the facet. It's a structural component that's part of the vertebrae. So when people talk about arthritis of it, number one, the arthritic condition doesn't cause pain. Arthritis doesn't cause pain. That's another fallacy. Arthritis is usually the wearing down of a joint surface, and then you either develop excess bone or reducing bone in the area, and it's a very slow process. It's not inflammatory. Osteoarthritis is not inflammatory. It's a mechanical wearing down. So the idea that it's going to cause pain, another fallacy. The idea that they found some structural variation reinforces the same problem, just like with the herniated disc and the stenosis of the foramen. They're just structural variations that are being found, but if you look at where the symptoms are, she's talking about symptoms in a butt, she's talking about symptoms in the front thigh. There's no way that the lumbar region where the facets, arthritis was found, could create pain in the butt or the front thigh. So it's clearly an independent variable. What's the lesson to Anna? Is that she's having a muscular deficit, which clearly is the case because her symptoms are always associated with activity. And with all the treatment she's gotten, and even, by the way, let's talk about the physical therapy that she's getting. She says that she's doing upper body twists, knee raises, squats, 3 on this and 1 on the other, recumbent pike. None of that addresses the very specific muscles that are creating her symptoms. I mentioned that it's the gluteus medius, and there are a couple of muscles such as the gluteus maximus, the hamstring, that work in conjunction with these muscles to maintain optimal posture, to maintain optimal function. So just doing some generic nonsense, and this is common, this thing with the bicycle is worthless. It's not going to do anything for strengthening. All those exercises, I hear nothing about the idea that they're using some sort of progressive resistance, which is to say that you take a muscle, you make it do an exercise where that muscle is responsible for moving the one joint in one direction that it's responsible for, and then applying resistance to it, and allowing the muscle to adapt to the resistance by getting stronger, and then you progress the resistance and make it harder, and then the muscle adapts and gets stronger. That's the basis of the Yass method. That's what Yassircise is. Yassircise is taking a muscle, understanding how to create the exercise, which allows that one muscle to move its one joint in one direction, thereby isolating that muscle and causing it to adapt to resistance. That's how we get stronger in each individual muscle. We need to make each individual muscle get stronger so that all the muscles have enough force output until they have a greater output than the force requirement of activity, therefore preventing it from straining and illicit pain. That is not being done. That has been done by nobody. The chiropractor, the physical therapist, nobody in the medical system is going to do it because nobody understands strength, its relationship to function, the idea of how to weight lift or strength train in a way to develop strength. That's all outside the medical system. It is at the core of the Yass system because I developed it. I literally, and it's strange enough, can say I took a high school physics course and applied physics to weightlifting. I've been lifting weights for 33 years. For 27 years, I've used targeted strength training, isolated strength training to treat people, to resolve their pain and return them to full function. All based on an understanding I developed completely independent of my medical education, which I have a doctorate in physical therapy, which has no basis involved in what I do. So I think I answered all the questions. Hopefully now Anna has an understanding of the SI joint and how to know if the SI joint is creating pain, has an understanding of what can create pain around the area of the SI joint, what inflammation is, what is facet joint arthritis. I think I've got through. She talks about that the pain is most when she sits or stands. Well, when she sits, she's actually sitting directly in the area where the piriformis is, and when she's standing, her muscles aren't strong enough to support her. So as a result, she ends up having pain. She mentions that she has difficulty once she stands and standing upright. That's actually an indication that the muscles in the front of the pelvis, called the psoas muscles, have shortened. Remember, I said along with the gluteus medius, you want to strengthen the hamstring and the gluteus maximus, which is the butt muscle. You need to strengthen those because there are other muscles that have a tendency to shorten, such as the psoas muscle. And when that shortens, it makes it difficult for you after you're sitting to stand upright. So that's why part of the exercise mentality is to get all the muscles, all the key muscles involved in the dysfunction that's happening and can be seen through the presentation of symptoms, including something like a recognition that once she stands, she has difficulty, or once she tries to stand, she has difficulty straightening up. So I think I got everything for Anna. Hopefully those who have had pain in the SI joint region will benefit from this. Thank you, Anna, for your email. I hope that you comment on the bottom of this video, or even email me and let me know if I've achieved the goals that you were seeking. If you have any desire for me to help you just reaffirm the diagnosis or help you perform the exercises correctly so you know how, we could always do a Skype or Zoom session. It's something I've been doing for years to get in touch with me in respect to that. You have already emailed me, but I'll just let everybody know you can contact me by email at drmitch@mitchellyass.com, drmitch at mitchellyass.com, drmitch@mitchellyass.com. If you like this video, hopefully you do, and I'll be doing more of these as people come in, so everybody knows. Vicky is next. Vicky is next because she wants to know everything there is to know about stretching, when it should be used, how to do it correctly. Is there any time when stretching is not valuable? What's the relationship between stretching and strengthening? This is going to be a great video. That's going to be my next one. Everybody, if you get to the end of this video and you see this and you want me to do a video about something pertaining to you, send me an email or comment and we're going to get to you, okay? This is a great way of reaching out to people and making these videos personal, which is what I want. If you like this video, give it a thumbs up. If you like my YouTube channel, Dr. Mitchell Yass, please subscribe. More now than ever, because now you're going to be getting videos that are personal to you. Again, if you want a Zoom session, Skype session, you want me to help you diagnose you correctly, and if confirmed to be muscular, which it is in more than 98 to 99% of cases, which is almost everybody, we can help you get the right diagnosis, help you understand how to do the strengthening exercises you need. The best part about this whole thing is all of these are videotape. You'll literally get a videotape of your session when it's complete. Let's keep this up. We're spreading the gospel. I've been doing some videos, some Zoom sessions for people in Canada, Australia, England. This is working, man. We're reaching out. We're beating down the medical establishment. People are recognizing there is an alternative, that the medical system is not a monopoly. And that's what I'm searching for. I'm trying to get as many people to realize there is a logical alternative, just like when you hear the discrepancy between what Anna's been through, and she's been through the mill, versus what I'm describing. It is clearly a chasm between my understanding of the relationship of the causes to dysfunction and the symptoms versus the medical establishment. So let's keep this up. All right, for now, Dr. Mitchell Yass wishing you a pain-free, fully functional life. Bye-bye for now.